I've entitled this presentation Child Brides and Child Domestic Workers in Ethiopia, Two Sides of the Same Coin. And this is because I'll be describing the circumstances of two categories of very poor girls in Ethiopia, often who originate from the same population of rural poor. As you probably know, just as background, Ethiopia is the second largest country in sub-Saharan Africa with a population of 84 million. 84% of the population is rural, which makes this a very rural country, even by African standards. If you look at adolescent girls only, we have about 8.5 million adolescent girls in the country, and if present patterns continue, nearly 5 million of those girls will be married as children by the age of 18. This slide just shows levels of early marriage in the country, and it's based on life tables from the latest DHS for 2011. And it shows the percent of Ethiopian girls married by age 15 and by age 18. As you can see, among rural girls, nearly 1 in 5, 17%, are married by their 15th birthday. And in very large regions, like the Amhara region, 1/3 of girls are married during early adolescence or by their 15th birthday. Not surprisingly, the vast majority of these marriages are arranged. This slide shows how the timing of the marriage is really also reflective of the terms of that marriage. In this graph, in this slide, I've graphed the percent of girls who know about the marriage beforehand and percent of girls who experience a forced sexual initiation, graphed along the x-axis by the age at marriage. And as you can see in both cases, they're nearly perfect linear relationships. The earlier that one gets married, the less likely it is she knows about that marriage beforehand, and more likely it is that she experiences a forced sexual initiation. And I'll just read the quote of one of the girls. She says here, "I hate early marriage. I was married at an early age, and my in-laws forced me to sleep with my husband, and he made me suffer all night. After that, whenever it gets dark, I get worried thinking that it will be like that. This is what I hate the most." So Burhani Hawan is Amharic. It means light for Eve, and it was the name given by the community to a program to delay marriage and support married girls. It's a program of the Ministry of Women, Children, and Youth Affairs and the Population Council. And through this program, we mobilize girls house to house, aged 10 to 19, with adult female mentors. Once these girls are mobilized, they are offered, for girls that want to return to school or remain in school, they're offered very modest school material, about $4 per girl per year in simple school material, notebooks, pens, and pencils to address the economic barriers to schooling. For girls that maybe don't want to go back into the formal school or can't for one reason or another, we offer out-of-school non-formal education, basic literacy, as well as HIV and reproductive health education. And then this program also offers a conditional cash transfer. So for families who are willing to keep the girl in school and unmarried for the duration for 2 years, in this context, they're offered a goat, which during the period of the study had a value of about $20 US. For girls who are already married in the program, they not only meet in their girls' groups, but we also subsidize the cost of a clinic card, which facilitates them getting family planning if they'd like to have family planning. This was a quasi-experimental research design with pre- and post-intervention population-based surveys in experimental and control areas. And in the end, we found the strongest impacts among the youngest girls. So girls in the project area, aged 10 to 14, were 3 times more likely to be in school, and 1/10 as likely to be married compared to their counterparts in the control area. And married girls in the project site were 3 times more likely to be using family planning. So this just shows that, with a relatively modest investment at the level of the girl, you can delay the earliest marriages for girls in these rural areas. I'd like to take a few minutes and talk about the poorest girls in urban areas of Ethiopia. About 10 years ago, we did a population-based survey of adolescent boys and girls in the Mercado slum of Addis Ababa. In that survey, what we found early on is very high prevalence of the adolescent population were immigrants to the area. And moreover, we found an excess of girls who were rural urban migrants. When we went further to ask girls and boys why they migrated, about a quarter of them cited escaping early marriage as the reason for migration. Also, if you look at the entire population of adolescent girls, you had high proportions of girls in domestic service. So fully 15% of girls, or 1 in 7 girls, were working as domestic workers. And if you selected out only the girls that were working for pay at the time of survey, fully 77% of these girls were in domestic work, which really does show you that if you're a poor girl living in urban slums, domestic work is one of the only work roles available to you. In that survey, girls also described backbreaking hours and conditions in their work. On average, they worked an average of 64 hours a week, earning an average of 54 birr, at that time $6 US per month. And subsequent research that we did showed that these girls are also highly vulnerable to non-consensual sex. I'm going to just read a couple of the domestic workers in our studies and them describing their experience of work. This is a little girl aged 10 years old. She said, "Where I used to work, the employers never let me wash myself and they wouldn't give me food. I used to starve. And because I wasn't able to wash, I had sores. I was carrying so much water on my back, I used to fall down." And this second little girl, she's only 14. She said, "Most of the time, the child of the employer beats me without having a reason. When I ask him why he does that, he beats me again." So Buru Tesfa means bright future, and this is a program for domestic workers and urban rural migrants in urban slums of Ethiopia. Like the married girls model, we recruit mentors from those slum areas and train them as mentors who then go house to house to mobilize girls aged 7 to 24 who are specifically out of school. It's during that house-to-house visit where they can actually negotiate for participation of the domestic worker, for example, if she wants to take part in the group and is not allowed. Once these girls are mobilized, they participate in age-segmented groups that meet 3 to 5 times per week, depending on the circumstance of the girl, and they typically meet in local town halls or kabeli structures. Once these girls are in groups, they're provided an identity card, and there's an example of such an identity card here. This will often be the first picture that's ever been taken of a girl, and certainly the only form of identity that she has. Once they're in the groups, they're provided with basic literacy, financial literacy training, HIV and reproductive health education, and other topics such as gender-based violence. Very often these girls migrate from rural areas before they start menstruating, so they don't know how to manage their menstruation when it starts happening to them. So through this project, we provide them with locally made reusable sanitary napkins, and that opens up the discussion on menstruation. And when we started doing that, we found out that many of these girls don't even have underwear. So we started providing them with underwear through the project. More recently, we've developed partnership with medical services in those areas. We have a partnership with roughly 70 clinics in the catchment areas of our project sites, and where we jointly subsidize medical services, basic medical services, and HIV services for girls in the program. Buru Tesfa has been expanded to 18 cities. We've indeed reached a large number of vulnerable girls. About half of them have never been to school, and about 2/3 of them are either domestic workers or daily laborers. 4,000 girls in just about a year and a half or 2 years have taken taken advantage of our voucher scheme, with large proportions of these people being domestic workers and disabled participants. I'd like to, before I end, highlight a few programming principles. These are two examples of targeted programs which have been built based on evidence, and where we're really targeting the poorest children in the poorest parts of the country. We specifically attempt to channel the vast majority of our resources directly to the children, but we also make maximal use of existing infrastructure and make our program elements always consistent with the local realities and the local economy. And then the other thing is, from day one, we design these programs for ultimate scale up. Finally, when we started this work, both with married adolescents and with domestic workers, there was a lot of skepticism. A lot of people said you would never have access to these girls. Domestic workers will never be let out of their houses. And we've proved them wrong. Since about 2007 or 2008, we've reached 220,000 girls in rural Amhara, both girls who are already married and girls at risk of child marriage, and 55,000 girls, many of them child domestic workers, in 18 cities of Ethiopia. Thank you very much.